How to kinesio tape the upper leg and hip. A Burkhardt Physical Therapy Center, LLC production.
Hello, my name is Sean. I'm a doctor of physical therapy at Burkhardt Physical Therapy Center in West Salem, Wisconsin. Today I'm going to be showing you a video of how to kinesio tape the outside of the hip. This type of technique can be used for any type of lateral hip pain or outside hip pain, hip bursitis, T-band tightness, or swelling in the leg. And what I'm going to do is I have a couple of pre-cut strips here. And the first thing I'm going to do is put the patient in position, or if you're doing this on yourself, you can be standing just like this. I think it works best in standing, that way you have access to both arms and you can easily move your leg into the right position. What I'm going to have the person do is bring the foot up and forward for this first strip. And with this strip, I'm going to anchor it on the bottom, coming right below the bony part on the side of the hip. So if you have a hard time finding that bony position, what you can do is have the person or you yourself turn your foot in and out, and you can feel that bony spot moving underneath your fingers. Once I have that position, I'm going to start with my anchor strip just below that, about 3 or 4 inches, and then come up around that bony position and then anchor it again on top. And then making sure to rub the tape, activate that adhesive. For the second strip, the patient's leg will be back and behind them, back here. And again, I want to make sure that I'm going right around that greater trochanter, or the bony part on the side of your hip. Starting with anchoring at the bottom, you can come right over top of that other strip. I'm applying about a 25 to 50% stretch, coming out behind and around, and then meeting up at top again, relaxing that tape so there's not a stretch at the top. Making sure to rub it, get it nice and stuck on there. For the third strip, it's a little bit longer strip, and that's just going to run all the way across the side of the leg or the IT band. And I want to start this one, you can start it wherever, if there's a pain down the side of your knee, or you can even start below where the IT band attaches to the leg. And then you can kind of pre-measure it. You want to give it a little bit of, it's going to be a little bit short than the shorter distance in the leg, because we're going to stretch it as we apply it across the leg. We'll start down here, and the patient's position for this is going to be where that last strip was, so back and behind the patient. As I come up, attaching as I go, coming right down the side of the hip, and it should cross right over that bony prominence. And if you have a little extra, you can always cut off at the end, but you just want to make sure that you have that tape on slack at the end. That anchor strip. And for this last strip, this is used for if there's a specific point of tenderness along the side of the hip. I'm going to take it's a smaller strip, and you're just placing it with full stretch anywhere along the leg where you have the most amount of tenderness. So if you kind of run your fingers along the leg, and there's a spot once you hit, and you can just feel it just kind of really hurts, or you can do it down at the attachment point for the IT band. There's another tender spot on most people. I'm just going to rip it right down the middle, put it on full stretch, and then anchor it on each side, making sure it's nice and it's not stretched on the bottom. So again, this technique can be used for any type of lateral hip pain, hip bursitis, IT band tightness, or swelling in the lower extremity. For this video and more kinesio taping videos, visit us at www.burkhardtpt.com or the Burkhardt Physical Therapy Center Facebook page.